I am Dr. Joel Cleveau, dermatologist in Quebec City. I work at the Man Oman Skin Cancer Clinic. Usually I refer to actinic keratosis more as solar keratosis because it's explained that it's caused by sun. It's a marker of sun exposure. We have been trying to convince the population for years to prevent skin cancer, to avoid sun, to protect themselves, and it's hard because people like to go in the sun. People like to enjoy their time outside. So with the aging population, we see more and more patients coming with solar keratosis that we need to evaluate and we need to treat. Solar keratosis or actinic keratosis usually present in the older population, especially in men. Of course, the solar keratosis arrive on sun-exposed area like the bald scalp, the nose, the forehead, and cheeks, ears. So it's very important for family doctors and dermatologists to examine our patients, especially if they have work outside, like outdoor workers, farmers, construction workers are very high risk to develop actinic keratosis. Solar keratosis are precursors of skin cancer, the carcinoma type. So they are a marker that the patient have taken too much sun, and also it's a precursor. So we tend to treat solar keratosis to decrease the risk of skin cancers. Of course, there's many different situations. Some patients come and they have 1 or 2 solar keratosis, and others have 50s, 60, all are on their face and the scalp. So we have to evaluate the patient, decide how we're going to treat them, and explain that it's very important to prevent and also continue to use sunscreen and avoid sun. Solar keratosis are hard to treat, and as I said, it's a marker that the patient have taken too much sun. So often when they start developing those lesions, we will have to follow them at least once a year. They will have to be taken care of by their family doctors too. And I try to explain the patient how to recognize the dangerous lesion on their skin. So ideally, they have to know how to differentiate a solar keratosis and a skin cancer. Even for family doctors and dermatologists, it's not always easy to differentiate solar keratosis than skin cancer. But most of the time, the patients are alert and they find their actinic keratosis. They come to see you with those lesions. They are scaly, crusty. They touch their skin and they feel. Usually, solar keratosis don't bleed. Cancers can bleed. Cancers grow. So for patients at risk to develop skin cancer that have many solar keratosis, I give them brochures. I explain them to recognize what is a skin cancer. Usually when they have something growing fast, I tell them usually it looks like a peanut, looks like a small wart growing very fast on you. You have to see your doctor. If a lesion bleeds and it stays at the same place for more than a month or 2, this is considered to be a suspicious lesion. So yes, we can differentiate solar keratosis and then carcinoma. It's not easy, but that's why we have to inform the population and the doctors how to recognize. As I said, solar keratosis usually arise on skin where they have a lot of exposure, like the scalp, the nose, and face. If you have a patient with many lesions, you will examine the whole area, and where you find a lesion that is bigger, thicker, and if it bled, then you will be encouraged to do a biopsy. Most of the biopsies are done by dermatologists, sometimes by family doctors, and they have to be evaluated by pathologists. So it's very important when you have a suspicious lesion that is bigger and thicker than the others, that either you refer to dermatology or you do a biopsy to make sure it's not an early skin cancer. Solar keratosis, often they are multiple and they are chronic. They are there for many months. So the most difficult part is you want to encourage the patient to treat and decrease the number, but it's not easy. A lot of dermatologists have used in the past liquid nitrogen cryotherapy because it's a fast procedure we use all the time in the office, but it's only good to treat a few lesions, 3, 4, sometimes 10 lesions, but more than that, it's very difficult. So the problem with treating patients with actinic keratosis is the fact they have many lesions, they have taken a lot of sun, their skin is damaged, and those lesions keep coming back. So it's a big challenge for all the dermatology community to take care of those patients, and we need patients also to understand well their disease and participate in their treatment. Usually, I tend to divide the patient in two groups. Patient with a few actinic keratosis, I usually treat with liquid nitrogen and encourage them to protect. I tell them this is an early warning sign telling you that you will have to protect because you're young and you're already developing precancerous lesion. When you get an older patient, usually outdoor workers that have many actinic keratosis, that is the big challenge. Usually I treat with liquid nitrogen a few of the thicker lesions that I'm not concerned they are cancer, just the more difficult actinic solar keratosis. And after that, I offer them the various treatment that we have available now. Treatment for actinic solar keratosis is not easy. Usually they are creams the patient have to apply for many weeks, and they have side effects. They can have some redness on their skin. They will have to withdraw from work for a little bit of days, a few weeks. So we will have to select the motivated patient to treat and explain them it's not just an affair of one visit. They will have to come back for follow-up. First, we have to continue to inform the population that sun is bad and damage the skin, because still we have a lot to do in that field, even though we have done campaigns for more than 20 years. We have to teach family doctors to recognize the early sign of skin cancer and precancerous, because the burden of patient is too much only for dermatologists. So really, it's a team effort with the family doctors. We have to stratify the risk. We have to select the patient and treat those with higher risk to develop skin cancer. And once we're sure they don't have skin cancer, we have to embark on a treatment scheme where they will have various options. As I said, treating patients with actinic keratosis is not easy, and often it's easier with motivated patients that are willing to use the different creams to treat themselves.